Hospital. Today, I'm very happy to share with you the experience and the safety of Zenjer surgery for open-angle glaucoma in East Asian eyes. Zenjer implant can provide us a communication between the anterior chamber and the subconjunctival space. It is indicated in the case of open-angle glaucoma. Here is the Zen surgery. I won't go through the details of the surgery, but I want to point out the most important is that when the injector goes through this conjunctiva, it should place the Zenjer on the supratenon's capsule. The postoperative care is also very important. You should be very aggressive in the postoperative anti-inflammatory regimen, such as to use 1% pre-forte every 2 hours for up to 2 to 3 months after the surgery. Also, you should look any signs of the aggressive healing response, such as encapsulation or fibrotic band. Here is the example. We can see that after several hours after surgery, the Zenjer stand, we can see the subconjunctiva portion is bending, and there are some tenting of the conjunctiva. After the needling procedure, we can see that the Zenjer implant remained relatively straight after the revision. How to manage postoperative IOP elevation? I think the postoperative first week is the most important. You should do the gonioscopy to see if there is any steroid response or the bleb is flat. Also, you should look for the internal occlusion. From the right side, we can see in the AC, the Zenjer tip, we can see a very small white material, that is the lens material, because the patient is also received the cataract surgery at the same time. After the YAG laser, the white material disappeared. Here, I want to show you some cases. This is a case 1. This is a 48-year-old male, and he had very advanced glaucoma of his both eyes. He received Zenjer surgery in his right eye, and he received trabeculectomy in his left eye. So we can compare the bleb appearance of these two different surgeries at the same time. After the surgery, we can see that from this anterior segment OCT image, the Zenjer implant is here, and there are some subepithelial microcystic formation here. And from the right side, we can see there's a fluid accumulating beneath the tenons. Here is the case 2. This is a male patient, and he received Zen surgery of his right eye, and after surgery for 1 week. And this is after surgery for 1 month. We can see the bleb is formed very well. However, after 10 months, this bleb become encapsulated. After the needling procedure, we can see that the bleb is from the encapsulated to the very diffuse form. This is the case 3. This lady had Zen surgery in her left eye, but unfortunately, he had received mitomycin C needling but failed. So we have to do the open revision for her. After the revision procedure, we can see the bleb is diffuse formed. Here is the case 4. Recently, we have done several Zen implants via an external approach. The injector will penetrate the conjunctiva 7 mm from the limbus, and the sclera entry site is about 2.5 mm from the limbus. When you penetrate the sclera and the injector will go through into the anterior chamber. When you see the tip of the Zen implant, you should retract the injector a little bit and then release the Zen gel. So you can observe that the bleb will form very instantly, and this bleb is very beautiful. Here is a table to compare the internal and external approach. Although the external approach had less tenons entanglement than the traditional AB internal approach, but the external approach is less predictable in the angle entry side, and usually you should do some adjustment for optimum position. However, the external approach is suitable for sunken eyes, small eyes, high risk of the failure, such as young patient and the patient with inflamed conjunctiva. Here we can see some results of the Zen implant. From this study, we can see the complete success is about 66%, and the qualified success is about 90%, and the needling rate is about 34%. How about our surgery and our outcomes in our patients? This is a retrospective single-center study, included the first 30 eyes of 30 patients with medical uncontrolled POAG. And we can see from this figure, the baseline IOP is around 21 millimeter mercury, and after 12 months, the pressure is reduced to 15 millimeter mercury, and we also found 14 patients, that's about 46% patient need postoperative intervention, such as needling procedures. Our study also showed that qualified success is about 80%. So we concluded that the Zen gel implant has effectively reduced IOP in our patients, and no serious complications was observed. But almost half of the patient require some form of wound modification procedures. And we also noticed that the postoperative IOP at 1 month is a predicting factor of surgical success 12 months after surgery. Conclusion: Zen implant has the advantage of less invasive intervention than trabeculectomy. Despite satisfactory successful rate, some eyes may need revision procedures for better IOP control. Thank you for your attention.